Anesthesia for hair restoration procedures. Most commonly, these procedures in my office are performed under a Valium, oral sedation, sometimes with an Ambien. Sometimes patients can take more than one Valium over the course of a procedure. That seems to be the most effective and the most comfortable for my patients. Anesthesia, local anesthesia, is also injected into the areas where the hairs are obtained from, as well as into the areas where the hairs are placed into. Those are done with very tiny needles, with my nurses holding the hand of the patient to make it a very comfortable experience. We do also offer twilight sedation in our office. We have a board-certified nurse anesthetist. It's been with me now for over 23 years, and he's able to provide twilight sedation. This is not just particularly important in cases where we're doing body hair harvesting, but for any time a patient wants to have a transplant procedure, really remembering very little to nothing of the procedure and having no discomfort at all. Because once the anesthesia is injected, the patient feels nothing. And quite frankly, in most cases, nearly all cases, we're able to inject the anesthesia, so it's really not painful. But in those patients that have a high anxiety level, having the procedure done under twilight sedation can make it for a more comfortable procedure. There is a small additional cost, but for most patients that have it done, they feel that this is worthwhile. For some of the more advanced procedures, such as hairline lowering surgery, those are routinely done under twilight sedation. This is Dr. Epstein talking about anesthesia options with hair restoration surgery.